the EMA, in every committee, there is a patient or patient representative involved. So, or they are invited as experts, or they are members of that specific committee. So even in the COMP, the Orphan Drug Committee, but also in the Pediatric Committee, main one, there is the PrEC. There are in all these committees patient representatives. So that is all over the place. Nobody has to worry about that, that we are left out. The other thing is there is the Patient Consumer Working Party. So that is a little bit less drug development, a little bit more also like now in COVID, how to explain things to the patient community, how to speak with the larger public, let's say. And there's also opportunities now, that's a new program of the EMA, so patients can send their comments on a certain product or procedure to the EMA and will also be heard about that. So there's many ways where patients can have an influence or at least make themselves heard. And I think in the FDA, I don't know all the details, but there's also more and more programs where patients and patient representatives are involved. And I think it might be worth looking at. There's a paper, if you just Google my name or go to PubMed and type my name, VROOM, and drug development, it will pop up, and it's about the evolution of the patient role in drug development, and it describes very nicely what is done in the EMA and also in the FDA. So in the EMA, in every committee, there's a patient representative or invited as a kind of guest expert or as a member of the committee. In the US, the FDA has established an approach called the patient-focused drug development, and the idea is to systematically incorporate patient experience into drug development and evaluation. So there is great demand for scientific measures, advancements to measure and integrate the patient voice into decision making. But we see everywhere that there's more and more interest, and also like in HTA, it's important to have the patient voice there, but we still need a lot of work there. But again, the EMA and FDA are both really working on it to make sure that the patient's voice is integrated in the decision making.